Mark Jabin here, Medical Director for Haywood County Health Department, and let's continue our look at measles. Do you need a booster? What treatments actually work? And what if you are traveling? Now, MMR, that's measles, mumps, and rubella vaccination, is a two-dose series, given at 12 to 15 months and again at 4 to 6 years. It protects for your whole life with measles. Two doses are 97% protective for measles, one dose 93%. Now, if you were born before 1957, it's assumed you had measles at some point and you are protected. If you were born between 1957 and 1968, you may have been vaccinated with a killed virus vaccine that was subsequently found to be not as effective and was pulled from the market. Between the 1960s and the 1980s, you may have just gotten a single dose. So, in either of these cases, you would want to get a booster. Children between 6 months and 1 year of age in the midst of an outbreak exposure should receive a dose. Now, if you've had two doses, you are protected. And if you have concerns about your protection, the recommendation is not to test for antibodies because the current tests are not sufficiently accurate at low levels. If you're unsure, best is to get another vaccine dose. The measles vaccine is a live virus vaccine and could cause a problem if you have an immunocompromising condition, are older, or have underlying health issues, or on any treatment that might suppress your immune system, like chemotherapy. So if so, please talk with your healthcare professional to sort this out. There have been suggestions by government officials that vitamin A, cod liver oil, budesonide, that's a steroid, and clarithromycin, an antibiotic, treat measles. If only this were true. Neither steroids or antibiotics have ever been shown to be helpful. Cod liver oil contains some vitamin A, and vitamin A is only possibly helpful when the child is deficient in vitamin A, a risk where significant malnutrition exists, not likely in developed countries. It is only used here in the United States for children ill enough to be in the ICU, and then only for a couple of days. Vitamin A does not prevent measles. So if you're thinking just give your child vitamin A, please think again. Over-the-counter supplements with vitamin A are not subject to quality controls, so you never know what you're actually getting, and it is possible to overdose on vitamin A. A single too large dose can cause swelling of the brain, and longer-term overuse can cause liver and bone marrow problems. So what about travel? Since 2020, vaccination rates have declined in the United States and all over the world, leading to worldwide outbreaks. If you're traveling to a place with an outbreak here or abroad, consider that vaccination is the only way to adequately protect your child and yourself. And you might be surprised by the list of countries with measles outbreaks. It includes much of the Middle East, Southeast Asia, Africa, and some places in Europe. So see here for a list of the current countries. So there you have it. In these two videos, everything you need to know about measles right now, based on careful study and experience. Don't be swayed by those who would have you believe otherwise. Demand kindly. They explain why and how they have the views they have and what they base that on. Demand kindly. They explain how and why they can dismiss what we've talked about in these two videos in order to maintain their belief. If they can't, or if they respond with innuendo or personal attacks, that tells you all you need to know about whether they are worth listening to. And yeah, that will take a bit of work on your part, but right now there are voices in prominent places and positions that we unfortunately must remain skeptical about. We left open the door and measles has walked right through. Children are suffering needlessly with an infection that is totally preventable. So if your goal is to protect your child, not to mention yourself and your community, if you want to avoid a misguided choice, one that you could have seen at the time was not the best option, consider your choices carefully. So be well and be careful, especially right now.